Assalamu alaikum. I, Dr. Muhammad Akram, Department of Eastern Medicine, Government College, University, FAISALABad. I will discuss vitamin C. Vitamin C is a water soluble, white crystalline, odorless substance with sure taste. It is destroyed by heat, oxidation, exposure to air, especially in the presence of iron and copper ions. Alkalis also destroy it, and therefore its absorption is reduced in achlorhydria. Sources: fresh fruits and vegetables, citrus fruit, potatoes, particularly their skin, tomatoes, and green vegetables. Human milk also contain vitamin C, but it is not a good source. Functions: vitamin C acts as a coenzyme in hydroxylation reactions, hydroxylation of proline and lysine residues of collagen. Vitamin C is an essential nutrient for the formation of intercellular ground substances, including collagen of fibrous tissues, matrices of bones, cartilage, and dentine, and all non epithelial substances, including that of vascular endothelium. Connective tissues have the highest concentration of vitamin C. It also acts as an antioxidant. Metabolic role of vitamin C. Large amount of vitamin C is present in glandular tissue, especially in adrenal gland, cortex, and corpus luteum, and here it takes part in redox oxidation reduction reactions involved in the synthesis of steroid hormone. Vitamin C reduces ferric to ferrous form and helps in iron absorption from the intestine and its utilization. It takes part in redox reaction coupled with glutathione, cytochrome, NAD, NADP, FAD. Thus, it is of great use in the treatment of hemoglobinemia. It converts folic acid to a tetrahydrofolic acid. This reaction is necessary for the utilization of folic acid in the formation of in the maturation of RBC. Vitamin C hydroxylase proline to hydroxyproline. Hydroxyproline is found in abundance in collagen, which is the main protein of the connective tissue. Excretion. It is excreted mainly in the urine as such, and its derivatives dehydroascorbic acid and diketogluconic acid. It is also excreted in sweat. Uh, Preservation of chronic diseases. Vitamin C is one of the nutrient which also includes vitamin E and beta carotene that are known as antioxidant. These compounds decreases the incidence of chronic diseases such as coronary artery disease and certain types of cancers. The common chemical property is the ability to inactivate toxic oxygen derived free radicals. Toxicity. No acute toxicity has been observed, but the oxidized form dehydroascorbic acid is toxic. Thiamine, vitamin B1. The biological active form of thiamine or thiamine pyrophosphate is thiamine pyrophosphate, a coenzyme of thiamine. Thiamine pyrophosphate is required in the decarboxylation of alpha keto acid and in the formation and degradation of alpha ketol by transketolase in HMP shunt. Sources. Richest sources are whole grains and legumes, natural sources, and combination with starch husks of grain. Therefore, there is good reason for the belief that whole meal produces and unmilled rice are particularly healthy foods. In function, it is an important component of nervous tissue and is used in the decarboxylation of pyruvate decarboxylase for the fermentation of glucose to yield alcohol. Thiamine pyrophosphate is essentially required in the more complex pyruvate dehydrogenase and alpha ketoglutarate dehydrogenase reactions of citric acid cycle, which play a key role in energy metabolism of most cells. Riboflavin, vitamin B2, milk, egg, liver, and green leafy vegetables are good sources. Metabolic role. Riboflavin forms two metabolically active coenzymes FMN and FAD. FMN and FAD help in the redox reactions and take part in the synthesis of ATP through oxidation phosphorylation. Redox forms are FMNH2 and FADH2. Niacin, vitamin B3. The other names of niacins are nicotinamide, nicotinic acid, nicotine, and plagra preventing factor. Sources found in unrefined and enriched grains and cereals, milk and lean meats, especially liver. Limited amount of niacin can also be obtained from the metabolism of tryptophan. 60 milligram of tryptophan produces 1 milligram of niacin. Metabolic role. Niacin produces two biological active forms of coenzymes NAD and NADP. NAD and NADP help in reactions, reduce forms of NADH2 and NADPH2. NAD and NADPI2 act as coenzymes in the synthesis of ATP through oxidative phosphorylation. NADPI2 act as a coenzyme and carries H plus ions. It uses its H plus ions to keep the glutathione of RBC in reduced forms, thus preventing RBC from oxidative damage. Clinical uses of niacin. It is used in the treatment of hyperlipidemia. It strongly inhibits lipolysis and in adipose tissues, primary producer of circulatory free fatty acids. Niacin causes decrease in liver triglycerol synthesis, which is required for VLDL production. LDL, cholesterol-rich lipoprotein, is derived from VLDL in the plasma. Thus, both plasma triglycerol and VLDL and cholesterol in VLDL and LDL are lowered. Therefore, niacin is therapeutically used in the treatment of type 2B hyperlipoproteinemia. Thank you very much.